got a pulse of 80, strong regular, respiration 16.
Do you have an IV? No, Ellen. Just I need an IV and morphine and brain buffering. Are you feeling all right?
On duty today at Scripps Memorial Hospital outside San Diego
How's your chest now?
is Dr. Steve Bierman.
I'm going to get her a Toradol injection.
Here in the emergency room, he will see everything from the victim of an automobile accident.
Did you feel the seatbelt work?
To a man with congestive heart failure.
8 o'clock, I had it, and you didn't do nothing.
It's all in knowing how, right?
That's it.
That's it.
To a little boy with a broken bone.
It cracked. Was it loud?
And he'll treat them all in a way you've likely never seen before.
I want you to go very deep, deep inside yourself and find a peaceful place.
Because Dr. Bierman has a unique prescription for healing.
The pulse really has slowed down. Each breath deeper and deeper.
Hypnosis.
Tell me what's up.
Okay, New Year's Eve.
Patrick Cooney doesn't know it, but he's about to find out if it works.
Yeah, I hit my elbow right on the concrete.
Cooney has a bad infection in his elbow and can barely use his arm.
Okay, let me just feel it then.
What's worse, the standard procedure for treating this kind of injury can be extremely painful as well.
Yeah, even that, huh?
But Patrick may not require any drugs for the pain,
This is something I'd like you to really focus on.
just the power of his own imagination.
I won't need local anesthesia for this. The injection of local anesthesia itself can't be painful. I want you to allow yourself to go inside and imagine Patrick a particular time. He'll go back into that state and enjoy comfort while I'm doing the procedure. It's perfect and comfortable in every way. That's if it works. If it doesn't work, we'll come back and get some local anesthetic.
Always nice to have plan B.
Yeah.
Here's how it works.
Now let yourself take a deep breath,
First, Bierman moves his attention away from the emergency room.
where you can just see some perhaps surprising sight that you can spend a moment and marvel at.
And the pain.
Really focus out there now. Some beautiful sight to see.
Treating the wound without breaking the trance.
Something you can enjoy and relax, surprise. That's right.
Watching Bierman in action, it's obvious something is happening here. The question is, what?
What I want to do is I want to direct the conscious attention of that patient essentially anywhere but on that shot. I can just move their attention to, say, the visual realm. The first time a particular color had even been seen. And they're so preoccupied with watch that movie that they're not attending to what otherwise would have been painful. Oh, we got some fluid out.
Did you?
Yeah.
I didn't feel it.
You didn't need to feel it.
Now, there are some people, possibly even some other doctors, who would listen to that and say it's magic, it's gobbledygook, it's not true.
Well, it is true. Those very same physicians are doing hypnosis all the time. Why ever say to a patient, this is going to hurt? This is going to hurt is a hypnotic suggestion. And trance is control. And the control at times can be malevolent.
But according to Steve Bierman, hypnosis, simply put, is all about choosing your words.
How very talented your own mind is to relax yourself.
Anyone who learns the simple rules of, say, hypnotic language has learned basically that words matter. Discover how well you can feel in the morning. You can really feel that working. Is your heart strong?
I think so.
I think so too. And that therefore you pick your words. It's starting to heal now already.
Yeah.
Is your breathing better already? Your lungs and your chest look very good right now. And there are certain words that can become a part of your habitual repertoire, but you don't need to feel it. Actually forget to feel. As far as I'm concerned, it's all right for you to forget to feel the whole thing. And they help people. They help people feel more comfortable and get well faster.
You explain everything so nicely. I like that.
The American Medical Association approved hypnosis as a therapeutic technique back in 1958. But when Dr. Steve Bierman was board certified 30 years later, he became just the 200th American doctor accredited to use it. With more than 600,000 physicians in this country, an average of only 6 or 7 are trained in hypnosis every year. Give me your best, clearest statement, the best argument you can make to other physicians as to why this is something they should do.
The best argument is you're already a hypnotist. Why not improve technique and become a master at that? In the same way you can improve your technique and become a master in other aspects of your field.
The proper
presentation of the curative hypothesis.
It's a message that Steve Bierman takes to his class of medical students at the University of California at San Diego.
When I offer, say, an idea of warmth, and I see the face flush.
Bierman believes hypnosis should not only be available as an elective course in med school, but a required one.
It can affect a cure. Not only can, but does. Not only does, but has been proven time after time again by study after study to work. It works.
Indeed, studies have shown that patients who are hypnotized can recover from surgery faster than those who aren't. Hypnosis can lessen the amount of blood lost in an operation, and it can dramatically improve healing in burn victims.
How did this become something that was obviously the heart of your medical practice?
I discovered that it was a way I could participate in diminishing the pain and suffering that I see every day in the emergency department. Not only do people come in pain, but there are procedures that we do that intensify their pain. And at some point, I became overwhelmed by that. I thought, I just can't keep dealing with all this pain and suffering. It's an endless pageant. How's your leg up here? I learned that hypnosis was one of the answers.
Hypnosis is one of the answers for 27-year-old Steve Phillips, who fell off his motorcycle. Now he needs stitches to close a gash on his leg.
How's your visual imagination?
Along with the local anesthetic, he's also about to get a dose of Steve Bierman's hypnosis.
Allow yourself to, Steve, close your eyes and pay close attention to some things that I need to know. Okay? This is finger number 1, and so you can feel one moving. Right? So that here I'm moving 1, here I'm moving 2, here I'm moving 2 of them, and here I'm just moving 1. Are you with me?
If that sounds confusing, well, that's because it's supposed to. Bierman tries to move the patient's focus away from the pain by giving him instructions that are intended to confuse. Are there some people who would say, Steve, forget this.
Yeah.
I want the drugs.
Well, I never withhold the drugs. I'm giving the drugs probably before most people. You have one medicine in you already, and the other one's coming, and you're going to get a series of medications. It's not alternative medicine, necessarily. It's complementary. This complements the usual routine that any emergency physician in this setting would adopt. You can really feel that working.
Oh, yeah.
Notice how your breathing's becoming easier and fuller. Some people might say, just get it over with. I don't want to deal with this crap. But, others will say, yeah, okay, I'll go with that. Let's go. Where's Benjamin?
Yeah.
Oh, I'll be gosh darn. Doctors don't know everything, do they?
But hypnosis doesn't always mean a trance.
Can I look at this bear with you, Benjamin? His shoulders and arms look fine, don't they? This type of hypnotic work can be done with anyone who can focus their attention. Anyone. How's the other shoulder?
Good.
Take the case of 5-year-old Benjamin Go. He has a broken collarbone and is frightened of the emergency room.
What's your favorite cartoon?
Garfield.
Garfield. And can you imagine that time when you see Garfield getting into some mischief? Just pretending there's a TV there. I don't need a trance to tell this boy to pretend. Pretend is kind of the magic word in the hypnosis of children. To tell him to pretend that the screen is right there and just look. While you're looking at that TV, if somebody like a fly came up and sat right on your collarbone, you don't need to feel that, do you? No. And you can still watch a cartoon. You can forget to feel. Here's your permission. You can just look. And I don't know if you want to change that channel or keep watching. Locking into the patient. That's more important than anything else. That's where the real power, if you want to use that metaphor, comes from. I'll be here. You can call me. You can call me tomorrow and tell me how well you feel. and the driving force is the rapport between me and that patient. That's what really makes it work.
And does it work? Remember Patrick Cooney? He was treated with no anesthesia, just hypnosis.
Real. I can't believe that guy. It's unbelievable.
So from the patient's point of view, at least after this experience, did it work?
Yeah.
Yeah, it's very effective.
I never felt a puncture. Apparently he did. I can see blood all over the place. I was just being comfortable. And he's got a way of talking to you, and when he talked, I was like, if I can only go to sleep like that at night.
All the hypnotist is trying to do is to make use of talents that people have within them already. Significantly, though, we don't know all those talents. And that's what makes hypnosis fun and exciting. Is I'm in a position where I can discover those case by case.